Hello everyone, I am here to explain stomach today. Stomach is an expanded part of the digestive tract between esophagus and duodenum. Stomach is specialized for the accumulation of ingested food, which is chemically and mechanically prepares for digestion and passage into the duodenum. Stomach acts as a food blender and reservoir, and its chief function is enzymatic digestion of carbohydrates, proteins and fats. Location: the stomach is situated in the upper abdomen, extending from left upper quadrant downwards, forwards and to the right, lying in the left hypochondrium. Left hypochondrium, and it is located in the epigastric region. And umbilical regions. So the stomach is located in the left hypochondric region, epigastric region and umbilical region. The size of the stomach, it is around 25 centimeters long, and the mean capacity of the stomach at birth is around 20 to 30 ml. And in adults, the mean capacity is around 1 liter at puberty and 1.5 to 2 liters in adults. External features: stomach has 2 orifices, 2 parts and 2 curvatures. The 2 orifices are cardiac orifice. It is the superior opening or inlet of stomach, which is joined by lower end of esophagus. And cardiac orifice lies at the level of vertebra T11. So here we can see it is located at T11 vertebra behind the left 7th costal cartilage. So here is the seventh costal cartilage, 2 to 3 centimeters from its junction with the sternum. So this is the junction with the sternum. So 2 to 3 centimeters away from the junction of sternum. Sphincteric action at this orifice can be demonstrated only physiologically. So anatomically, if you touch and palpate, you cannot feel for the cardiac sphincter. Next, regarding the pyloric orifice, it is the inferior opening or the outlet of stomach which opens into the duodenum. And pyloric orifice lies at the level of lumbar vertebra L1. That is, it is located at the level of transpyloric plane, that is around 1 to 1.2 centimeters to the right of the median plane. Let's see the parts of the stomach. It is divided into 2 parts. The larger part known as the cardiac part and smaller part is called as pyloric part. The larger cardiac part is further subdivided into fundus and body. So from the cardiac notch, if we draw a horizontal plane towards the outer curvature of the stomach, so the part above to it is the fundus and below to that is the body. And the small pyloric part is subdivided into pyloric antrum and pyloric canal. Fundus is the upper dilated, that is the dilated superior part of the stomach, which is situated just above the horizontal line drawn at the level of cardiac orifice. So here is the fundus. And the fundus, it is related to the left dome of diaphragm. Body of the stomach is the major part between the fundus and pyloric antrum. So between the fundus, which is hiding below the liver, until the pyloric antrum is the body. Gastric glands are situated in the fundus and the body of the stomach, which contain all three types of secretory cells, that is mucous cells, chief peptic cells which secrete digestive enzymes, parietal cells which secrete HCl, that is hydrochloric acid. Next, regarding the pyloric part of the stomach, it has the pyloric antrum and pyloric canal. Pyloric antrum is about 7.5 cm long and has pyloric glands which are rich in mucous cells. Pyloric antrum narrows towards the right to become a pyloric canal, and which is surrounded by a sphincter called as pyloric sphincter, and which joins with the duodenum at the level of L1 vertebra. So this is the duodenum. So L1 vertebra, it is related to a plane called as transpyloric plane to the right of the midline of L1. The pyloric antrum narrows towards the right to become pyloric canal. So we can see the antrum gets narrowing to form the pyloric canal, which is surrounded by a sphincter called as pyloric sphincter, and which joins with the duodenum at the level of L1. So here is the duodenum, and it joins at the level of L1 vertebra, which is related to transpyloric plane to the right of the midline. And it is separated from the pyloric canal, that is pyloric antrum is separated from the pyloric canal by a sulcus intermedius, which is located on greater curvature. So here is the sulcus intermedius, which is located on greater curvature. Pyloric canal is about 2.5 cm long and its right end terminates at pyloric orifice. Curvatures of the stomach. Lesser curvature, it is a short concave right curvature of the stomach. And this lesser curvature, it provides attachment to lesser omentum. And the angular incisor is a notch, it is the most inferior part of lesser curvature that indicates the junction of the body and pyloric part of stomach. So angular notch or angular incisor is the most inferior part of the lesser curvature that indicates the junction of the body and pyloric part of the stomach. The lesser curvature gives attachment to two layers of hepatogastric ligament, and between these two layers are the left gastric artery, right gastric branch of hepatic artery. Next, regarding the greater curvature, it is the longer convex left border of the stomach and it provides attachment to the greater omentum. So here we can see the greater omentum. So gastrosplenic ligament and gastrophrenic ligament also attaches to the greater curvature of the stomach. At its upper end, the greater curvature has a notch called as cardiac notch. Which separates it from esophagus. Let's see the peritoneal relations. Stomach is lined on both the surfaces by peritoneum. The layers of peritoneum lining the anterior and posterior surface of stomach at lesser curvature meets to become the lesser omentum. So they continues to become the lesser omentum, and the two layers of peritoneum meet along the greater part of the greater curvature to form greater omentum. Two layers of peritoneum meet near the fundus to form gastrosplenic ligament. So they meet near the fundus and they further diverge to enclose the spleen. So it is the connection between the spleen and the stomach which is called as gastrosplenic ligament. Posterior surface of peritoneum near the cardiac end is reflected onto the diaphragm as gastrophrenic ligament. Let's see the anterior and posterior relations. Anteriorly, the stomach is related to the diaphragm. So we can see that here is the stomach, showing its anterior relations, and here is the diaphragm. That is the left dome of diaphragm. So anteriorly it is related to left dome of diaphragm and it is also related to left lobe of liver. And it is related to transverse colon. And it is also related to anterior abdominal wall. So the area which is not covered by any visceral organ, so this area is directly related to anterior abdominal wall. So let's see the posterior relations of stomach. Posteriorly, the stomach is related to omental bursa and pancreas. So the omental bursa is removed here to expose the structures forming the posterior relations or bed of the stomach. So posteriorly, the stomach is also removed here. We can see the cut part of cardiac end at the esophagus. And here is the pancreas. So the posteriorly, the stomach forms most of the anterior wall of omental bursa. So the bed of the stomach on which the stomach rests in supine position is formed by the structures forming the posterior wall of omental bursa. So from superior to inferior, the stomach bed structures are the left dome of diaphragm, and it is related to the spleen. And posteriorly, it is also related to left kidney and left suprarenal gland. And it is also related to the splenic artery. We can see it is entering the hilum of the spleen. And already we know it is related to the body of the pancreas. And it is related to the transverse mesocolon. Which is a peritoneal mesentery covering the transverse colon. And these structures forms the bed of the stomach. Let's see the arterial supply of stomach. Arterial supply along the lesser curvature is by the left gastric artery. So we can see the left gastric artery here. Which is a branch of celiac trunk. And lesser curvature is also supplied by the right gastric artery, which is a branch of proper hepatic artery. Arterial supply along the greater curvature, it is by right gastroepiploic and left gastroepiploic arteries. Right gastroepiploic is a branch of gastroduodenal artery. So left gastroepiploic artery is a branch of splenic artery. Right gastroepiploic artery is a branch of gastroduodenal arteries. These epiploic arteries are along the greater curvature of the stomach. So arterial supply to the fundus and the upper body of the stomach is supplied by 5 to 7 short gastric arteries. So here we can see the splenic artery. Which is a component of stomach bed structures. The splenic artery is posteriorly related to the stomach. So on its way towards the spleen, the splenic artery gives rise to 5 to 7 short gastric arteries. The pyloric part of the stomach is supplied by gastroduodenal artery. So the direct branches from the gastroduodenal artery supply the pyloric part of the stomach, which is a branch of common hepatic artery. Venous drainage. The right and left gastric veins drains into portal vein. So here is the portal vein. So right gastric vein. Right gastric vein is along with the right gastric artery. And this is the left gastric vein. So we can see the right gastric vein is a tributary of portal vein and left gastric vein is the tributary of portal vein again. Then about the right and left gastroepiploic veins, right gastroepiploic veins drains into superior mesenteric vein. So this is the right gastroepiploic vein. And this is the superior mesenteric vein. And the left gastroepiploic vein and short gastric veins drains into splenic vein. So splenic vein is not shown because it lies posterior to the stomach. So left gastroepiploic veins and short gastric veins drains directly into splenic veins. So this is all about the venous drainage of stomach. Lymphatic drainage. Lymph from the upper part of the left 1/3 drains into pancreatico-splenic nodes, which in turn drain into celiac nodes. So upper part left. So upper left means here. So these are the pancreatico-splenic nodes. So left upper 1/3 drains into pancreatico-splenic nodes. The lymph from the lower part of the left 1/3 drains into right gastroepiploic nodes. So lower 1/3, left lower 1/3 means here. So here they drain into right, that is they drain into gastroepiploic nodes. So these are the gastroepiploic nodes, and this further drains into subpyloric nodes. And here are the subpyloric group. Which lie just below the pyloric part of the stomach, and further from the subpyloric nodes, the lymph is drained into hepatic nodes and finally into celiac nodes. So hepatic nodes and finally into celiac nodes. So here is the celiac node, which is near to the celiac trunk. And now we shall talk about the lymph drainage from the right side. So the right 2/3 drains into left gastric nodes. So 2/3 of the right, this part, drains into left gastric nodes. So here are the left gastric nodes. And which in turn drain into celiac nodes. We can see they are connected to the celiac nodes. And abdominal part of the esophagus also drains into left gastric nodes. The lymph from the pyloric part drains into the pyloric, hepatic and left gastric nodes, and from all these nodes it drains finally into celiac nodes. Lymph from all areas of stomach reaches the celiac nodes. From celiac nodes, it passes through the intestinal lymphatic trunk to reach cisterna chyli and thereby thoracic duct. Nerve supply of the stomach. It is supplied by sympathetic and parasympathetic innervation. Sympathetic innervation is provided by the celiac plexus. So the nerve plexus originates from 5th to 11th thoracic spinal nerves, that is from T5 to T12, and travel to the celiac plexus via the great splanchnic nerves. Functions of the sympathetic innervation. It is responsible for inhibiting gastric mobility and constricting the pyloric sphincter, thus preventing gastric emptying. Parasympathetic innervation. is derived from the anterior and posterior vagal trunks and their branches, which enters the abdominal cavity through esophageal hiatus. So majority of the fibers within the vagus nerves are afferent, and these convey gut sensation including fullness, nausea and probably pain from the stomach. Anterior vagal trunk is derived mainly from the left vagus nerve. Because of the rotation of the stomach during development, the left vagus nerve is considered as anterior vagal trunk in relation to the stomach. Anterior vagal trunk mainly supplies a portion of anterior surface of the stomach as well as the pylorus, and it gives off hepatic and duodenal branches at the lesser curvature of the stomach, which leads the stomach into hepatoduodenal ligament. And posterior vagal trunk is derived mainly from right vagus nerve. Posterior vagal trunk innervates the remaining anterior surface of the stomach and entire posterior surface. It gives off a celiac branch which passes to the celiac plexus and then continues along the lesser curvature, giving rise to posterior gastric branches. Functions: the parasympathetic nerve supply is secretomotor to gastric mucosa and motor to gastric musculature, and inhibitory to the pyloric sphincter, which means it relaxes the pyloric sphincter. Stimulation causes the increased motility of the stomach and secretion of the gastric juice, which is rich in pepsin and hydrochloric acid. Referred pain. The pain sensation from the stomach is poorly localized and in common with other structures of foregut origin and is referred to epigastrium. Pain arising from gastroesophageal junction is commonly referred to the lower retrosternal and subxiphoid areas. Interior of the stomach. The mucosa of the stomach, that is the gastric mucosa of empty stomach, it is thrown into longitudinal ridges or wrinkles called as gastric folds. So you can see several gastric folds interiorly. So these gastric folds are nothing but the mucosal folds, and they are called as gastric rugae. And they are most marked towards the pyloric part along the greater curvature, and we can see they are more prominent near the pyloric part along the greater curvature, means here. So here is the schematic histological image of the wall of the stomach, where we can see numerous small depressions over the mucosal surface which are known as gastric pits. And these gastric pits, they open into the gastric glands. So these gastric pits are continuous with the gastric glands. So gastric glands open up into the gastric pits. During swallowing, a temporary groove or furrow like gastric canal forms between the longitudinal gastric folds along the lesser curvature due to the firm attachment of gastric mucosa to the muscular layer. When the stomach is mostly empty, saliva and small quantities of masticated food and other fluids drain along the gastric canal into the pyloric canal. So the gastric folds diminish and obliterate as the stomach is distended and fills. Submucosa of stomach, it is made up of connective tissue, arterioles and nerve plexus. So below the mucosa is the submucosa. Which mainly contains blood vessels. That is the arterioles, both venules and arterioles, and also nerve plexus. So deep to the submucosa means the outer to the submucosa is the muscle coat of the stomach. Most superficial fibers are the longitudinal fibers, which are mainly along the outer curvatures. So the outermost muscle fibers are the longitudinal muscle fibers. And inner circular fibers which encircle the stomach and are thickened at the pylorus to form the pyloric sphincter. And deepest layer are the oblique fibers which loop over the cardiac notch, and some spread into the fundus and body of the stomach. Functions of the stomach: it acts as a reservoir of food and mixture of food, and it often softens and mixes the food with the gastric juice by its peristaltic movements. And the main function of the stomach involves mechanical and chemical digestion of ingested food. Gastric juice produced from gastric glands contain enzymes which helps in digestion of food. The various enzymes and also the hydrochloric acid with the pH of 1 to 2 in the gastric juice break down the food even more and forming a semi-liquid substance called as chyme. So the acidic chyme passes into the duodenum through the pyloric orifice by a process called gastric peristalsis. Stomach also helps in absorption of vitamin B12 by producing intrinsic factor of Castle. The stomach also plays an important role in controlling secretion and motility within the digestive tract by releasing several hormones such as gastrin, 𝐒𝐭𝐲𝐵𝐷𝐼𝑛, secretin, and gastric inhibitory peptide. So let us do the detailed microanatomy of stomach, that is the histology of stomach. Mucous membrane. The mucosa is lined by simple columnar epithelium, which is covered by a protective alkaline mucous layer. So here we can see simple columnar cells. Which forms the gastric mucosa. The epithelial layer contains numerous invaginations which are called as gastric pits that extend deeper into structures called as gastric glands. And depending on the part of the stomach, these glands consist of various types of the cells. In cardiac end, the mucous membrane contains simple columnar epithelium with small tubular glands which contains stratified squamous epithelium of esophagus, which abruptly changes to the simple columnar epithelium of stomach. Fundus and body of the stomach. The mucous membrane contains gastric glands, which are the tall, simple and tubular glands, and of which upper 1/3 are conducting and lower 2/3 are secretory. Chief or zymogenic or oxyntic or parietal or mucous neck cells are seen in gastric glands, which are present in the fundus of the stomach. Pyloric part of the stomach. The mucous membrane here in the pyloric part contains mucous glands, that is pyloric glands, which are 1/3 of mucous secretory and 2/3 are conducting. Means the gastric pits are quite longer in the pyloric part and shallow in the fundus and the body of the stomach. So the conducting part means the pit is 2/3 of the pyloric mucosa in pyloric part, whereas in the fundus and the body, the gastric pit occupies around 1/3 of the mucosal thickness. Next, about the submucosa. Submucosa contains the loose connective tissue with blood vessels and nerve plexus which are called as Meissner's plexus. And outermost layer is the muscularis layer which is called as muscularis externa. The cardiac end contains the outer longitudinal and inner circular layer including the Auerbach's plexus or myenteric nerve plexus. So the nerve plexus in the muscular layer are called as Auerbach's plexus or myenteric plexus, which are present all through the length of gastrointestinal tract. And fundus and the body of the stomach contain additional innermost oblique coat of muscle fibers. Pyloric part contains pyloric sphincter, which is made up of thick layer of circular fibers. Serosa is a single layer of the squamous cells which lines the serosa, that is the outermost layer of the stomach. If we see the cells, 4 major type of secretory epithelial cells cover the surface of the stomach and extend down into the gastric pits and gastric glands. So the 4 types of cells are, first variety is the mucous cells. Mucous cells secrete alkaline mucus that protects the epithelium against the shear stress of acid. And parietal cells secrete hydrochloric acid. Chief cells secrete pepsin, which is a proteolytic enzyme, and the G cells secrete hormone gastrin. So this completes the normal anatomy of stomach along with its histology. Thank you.